Okay, this is lesson 9.2, which is pathology of the male reproductive system. So pathologic conditions are the hydrocele, which is a sac of fluid in the scrotum. Testicular torsion is when the spermatic cord gets twisted, right there. And then variocele is when the spermatic veins are dilated abnormally. Here is the prostate gland with carcinoma and BPH. So right here, the prostate gland 1 and 2. Here's a prostatic carcinoma, and then a benign prostatic hyperplasia on this one. That's also known as BPH. Hypospadias is the surgical repair that involves exciting a portion of the prepuce, wrapping it around a catheter, suturing it to the distal part of the urethra, and then bringing it to the end of the penis. Hypospadias. Urethral opening is now on the underside of the penis. Sexually transmitted infections, or STIs, include chlamydial infection, gonorrhea, herpes genitalis, HPV, or the human papillomavirus, and syphilis. There's some lovely pictures in your textbook illustrating the dangers of those infections. Lab tests, there's the PSA and semen analysis. So what does the PSA stand for, or what does it test for? Sorry. Levels of infection, sperm mobility, sperm motility, or levels of an antigen. So the correct answer is D, levels of an antigen. So the PSA is the prostate-specific antigen. That's what PSA stands for. So high levels of this antigen indicate that the prostate gland is enlarged, which can often be a sign of cancer. Clinical procedures include the transurethral resection of the prostate, which is often referred to as the TURP. This is where they insert a resectoscope in the urethra, down into the prostate gland, and then resection that. Clinical procedures are the vasectomy. So that is when the physician makes an incision right here, just goes in, cuts, and then blocks off both ends of the cut vas deferens, and then removes the excised segment and sutures it back up. So that is a form of sterilization. So which term means removal of the prostate? Orchiectomy, prostatectomy, vasectomy, or prostatitis? This one's pretty easy, right? We know ectomy means removal. Vasectomy is the removal of the vas deferens. Orchiectomy would be removal of a testes, so prostatectomy is pretty obvious. That's going to be the removal of the prostate. Okay, our abbreviations are BPH, benign prostatic hyperplasia, DRE, digital rectal examination, ED, erectile dysfunction, GU, which is genitourinary, HPV, human papillomavirus, HSV, or herpes simplex virus, PID, pelvic inflammatory disease, PIN, prostatic intraepithelial neoplasia, PSA, that's the prostate-specific antigen, RPR, rapid plasma reagin, STI, sexually transmitted infections, or you could refer to it as STD, a sexually transmitted disease, a TRUS or TRUS, that's the transrectal ultrasound, a TUIP, transurethral incision of the prostate, TUMT, transurethral microwave thermotherapy, a TUNA, the transurethral needle ablation, and the TURP is the transurethral resection of the prostate. Okay, so our combining forms are andro, balano, cryo, crypto, epididimo, Gono, hydro, orco or orchio. Pino, prostito, semino or semini. Spermo, terrato, testo, variceo, vaso, zooo. Suffixes are genesis, one, pexi, stomi. And to wrap it up, which term means no sperm or semen are produced? Spermolytic, anorchism, oligospermia, or aspermia. Well, remember that A, the prefix A means without. So anorchism would be without testes. Aspermia is without sperm. So A is the correct answer. And that wraps up lesson 9.2.